Okay, today I'm here to talk about ectopic pregnancy, especially the one that happens in the fallopian tube of a woman. What causes ectopic? What measures can you take so that you can avert this ectopic? Is what I'm here today to talk about. So let's move together with this discussion. Looking at this diagram, looking at this diagram here that I'm going to draw, you see this way here. This let's say that this is a woman uterus. Then there should be a line here. This central lining you are seeing is called endometrial cavity. Then there should be also fallopian tube, then ovary is somewhere here, ovary is somewhere here. So when the egg is being released into this fallopian tube through what is called the fimbria. This area is called the fimbria. This fimbria is to capture this egg from the ovary into this fimbria. Then it will push it through infundibulum. This infundibulum will now push it to a space, a potential and a larger space of this fallopian tube, which is called the ampulla. Within this ampullary portion, the egg is being ovulated, is being released into this place. Then the sperm cells have to travel through the vagina, then through the cervix to the endometrium, then it will make its way down to this region to break the egg, which is called fertilization. After this fertilization has occurred, this zygote, it will now turn to zygote. This zygote has to travel down to the endometrium to stay, because this place is not the right place for this zygote to start its joining as a pregnancy. So as soon as this zygote travels down, if there is any inflammation within this lumen of the fallopian tube, it will obstruct this zygote, this embryo. This very early pregnancy, it will obstruct it. And this inflammation can happen to the lumen of this fallopian tube as a result of bacterial infection like gonorrhea, chlamydia, maybe previous surgery on the fallopian tube, as well as even the ectopic of this endometrium can be found within this area. It can also be one of the causes of this ectopic. So what do you do to avert this problem? There are some steps you can take to avert the problem. Like I said, you can do something like HBS. You can do HBS test. You can also do urine MCS test. Then there is a specific test. There is a specific test for gonorrhea and chlamydia, which is very, very sensitive. And that test is called NAT. It's called NAT. NAT. N-A-A-T. NAT. NAT simply means nucleic acid amplification test. This is a type of test that is so essential, though very, very important, to rule out chlamydia or gonorrhea in a woman or in a man. For man, you use urine and urethral swab so that your doctor or your healthcare provider can proper solution if there is something like chlamydia or gonorrhea. And if there's nothing like that, maybe through any other inflammation, a medical doctor or your healthcare provider can use other means to treat you so that you can embark on how to get pregnant, and it will become easy and will not experience what is called ectopic pregnancy again. Although ectopic pregnancy can happen in other places, it's not only in the fallopian tube. It can happen in the cervix here. It can also happen in the abdomen. Even this area, which is called myometrium, it can also occur there. Provided it's not, found itself within this potential endometrial cavity, it can be called ectopic. but the commonest one is this fallopian tube ectopic. So if you have learned something from this video, do not hesitate to do the needful so that other people can watch and also get something from it. I remain Agatha Friday, a medical imaging technologist. Thanks.